Radiation therapy is actually the same x rays that our patients are getting today as part of CAT scans or a chest x ray. They're just a higher energy, so they give a treatment as opposed to taking a picture. The method that it works is that these higher energy x rays primarily work by damaging the DNA in the cancer cells, causing them to slowly pass away. Kidney cancer patients are referred to radiation therapy by often another member of their treatment team, most often medical oncology, but sometimes they're surgeons or even interventional radiologists, especially at large centers where we have meetings to discuss kidney cancer patients as a group. The concept of radiation therapy can be very scary. In fact, radiation therapy as x rays are things that you can't see or feel. And we know that radiation can be dangerous and can be even used um, in warfare. So, how can radiation therapy be safe? Basically, it's about how we aim it. By precisely aiming the radiation to focus it on the tumor and avoiding normal tissues that are nearby, that's how we can deliver these high doses of radiation safely without damaging other parts of the body. When we talk about a conventional course of radiation, what we're often speaking of is daily radiation treatments lasting many weeks, often 4, 5, or 6 weeks. For certain types of cancers, this is how we standardly deliver radiation. Normally, it's not our preferred method to use this type of radiation for kidney cancer, as that we don't think that it's as effective as giving the radiation in shorter courses with a higher dose of radiation per day. This idea of giving the radiation in a short course with a few number of treatments but a high dose per day is called stereotactic body radiation therapy, or SBRT. There are different names for SBRT in different centers in the United States and outside of the United States. One common name is SABR, stereotactic ablative radiation. And this emphasizes that the total dose of radiation is there to kill the tumor and not just control it. The concept of SBRT in the United States always means 5 radiation treatments or less. But in other parts of the world, this may extend up to 8 or 9 treatments as well. In our experiences with radiation therapy for kidney cancer, we think that SBRT does give a better rate of long term control on small areas of kidney cancer that we can target appropriately. That doesn't mean that we always can use SBRT in the treatments of patients with kidney cancer. For example, if there are multiple spots of kidney cancer scattered through many, many, many parts of the brain, we cannot use an SBRT technique to treat the whole brain, and we would use a conventional radiation course, often of 2 to 3 weeks in that situation. Gray is a measurement of how much radiation therapy we give. And so we often speak about how much total gray that we're delivering of radiation over how many fractions. So, for example, if I say we're delivering 50 gray over 5 fractions, it means that each day the patient receives 10 gray to that tumor. A gray is the measurement of absorbed dose. Think about it as the way of energy that's coming in to a little part of the body, and it's not energy as heat, but it's energy as in radiation. When we deliver SBRT, which is large doses in just a few number of visits, as compared to conventional radiation, which is more often 20 to 30 small doses of radiation delivered in 4 to 5 weeks, we think the SBRT works better because the large doses of radiation per treatment can overcome resistance to radiation that kidney cancer can have to small doses of radiation. In the details of radiation therapy, there's a concept of biologically equivalent dose. The total dose of radiation that your body feels is actually different than the total dose of radiation that is delivered. And you can think of it in this way. If you are in the rain and you're out there, but it's raining very softly, you don't feel too wet, even if you're out there for like an hour. However, if it's raining very hard, the minute you step outside, you feel very wet. Now, the total amount of water that fell on you might end up being the same, a minute in a thunderstorm versus an hour in a drizzle, but you certainly feel different. In the same way, the cells feel different when it comes to radiation therapy. When we give 10 gray per treatment over 5 treatments, those cells don't have much of an opportunity to repair. And so that equivalent dose is higher than if we spread out the same dose over 10 treatments. Proton radiation therapy is different from the standard radiation therapy in the idea that protons use small particles, protons, as the treatment as opposed to X-rays. Now, protons are much, much larger than the photons that are in standard X-rays. This means that protons, when they're delivered to a patient with cancer, travel through the patient's body but don't pass through the body like an X-ray does. This can be advantageous when we're trying to get a high dose of radiation next to something that we don't want a lot of radiation to get to, and to reduce the total body dose of radiation. However, these protons can be quite finicky, and there's a lot of work that's necessary to make sure that the area of the body that we're treating has to be perfectly still and measured to make sure the protons treat the entire tumor. Also, most radiation therapy centers don't have protons, with just 1 to 3 facilities per state. When I think about the decision to use proton radiation or standard photon or X-ray radiation with SBRT, I do think about them as just tools in the kitchen. And so when you're looking to pursue treatment, you want to think about a chef who knows how to make the meal you want. And it may not be that important what brand knife or what type of blender that practitioner is using.